Good afternoon. Today is May the 11th, and it is now 1 o'clock. As a quorum of the subcommittee is in attendance, I would like to call to order the meeting of Central Health Eastern Crescent Subcommittee. As a reminder, one of our subcommittee members may also be participating by video conference, so the staff will be managing video and audio feeds for all participants, and closely to make sure that they are in legal compliance with meetings at all times. The first item for our agenda today is public communications. We have received public communication. We will receive public communications from both the Eastern Crescent Subcommittee and the Strategic Planning Committee before we proceed to the subcommittee agenda. Members of the public who wish to make comments virtually during the public communication portions of the meeting must be registered with Central Health via the online form or by telephone no later than 11:30 a.m. today. Yesenia, did anyone register to make comments?
No, Mr. Chair, nobody registered to make comments today.
No audio.
Yes. You're muted.
Can you hear me? Can you hear me now? Can you hear me?
You can shake your head yes or no. Okay. Thanks very much. Since there were no one who made comments, we will now proceed to the subcommittee agenda. Subcommittee agenda item number 1, receive and discuss an update on communication and community engagement activities and initiatives, including an update on groundbreaking events in Hornsby, Bend, and Del Valley. One question I have, do we have agenda that we need to approve from the subcommittee? Eastern minutes, I'm sorry. We don't have any, okay, all right. Just want to make sure. Okay, let's proceed with item number 1.
Thank you. Hi, everybody. I'm Ted Burton, Vice President of Communications for Central Health, and I'm excited to share with you highlights from our recent groundbreaking events in Hornsby, Bend, and Del Valley. We want to thank the residents who live in those communities, our partners, our outreach consultants, and of course, the dream team who are all watching from another room here. My colleagues in the communications department. We think the event set a new standard for outreach events, and not only for Central Health, but in Travis County. After we share with you some of those highlights from the events, we will pivot and talk about our communications and community engagement plans for the actual clinic openings, which are scheduled for the summer of 2023. But before we talk about the highlights, we want to actually take a look back and show you some of the highlights. And my colleague Mike McKinnon is going to hit play from another room.
As a former resident of this area, literally I used to live in this house right here back in 2004. I understand the need for health services in this community personally. Health was created over 2004 to improve the health of our community by providing.
I'm going to ask you to start again and make sure that it worked a little while ago.
It might be ours.
Breaking ground in East Travis County. That's where Central Health plans to open health centers in Del Valley.
It's in this room.
I think our audio is completely.
It's the audio in this room, others.
Can anyone hear me? No. So remote audio is not working at all anymore.
It was like I'm back in the news business trying to play the story and it's not playing. That may have happened once or 100 times. Exactly. Let's go to commercial break. I hear it.
Right, apparently there is no audio playing in the room.
Correct.
Because we could hear Yesenia remotely on the computer, but there's no audio actually coming into the room anymore. 5 minutes ago, and now it's
Can you reboot?
It's because the guy left.
as.
That's what I always try. When it's down.
It's just sitting.
Start over.
Another option could be if it's playing, you're hearing it on your computer. You could crank up your volume so the folks in the room could hear it, maybe. Just as a,
Yeah.
it won't be as high quality, but
Yeah.
But it's any remote participant, you're not gonna
well, we just want to hear the videos.
I think if you turn your speakers on.
There is no remote participant audio in the room whatsoever. And it just literally stopped working. Because they couldn't hear Brianna, they can't hear me right now, even though I'm unmuted. Now, remote participants can hear me. Hello.
Okay,
People online or community today, are we live? Are you telling them what's happening?
They're having technical difficulties.
Yeah, for those who are listening via public communication or outside of the meeting room, we're having some technical difficulties. We're in the process of trying to work them through, so please bear with us. We should be back with you shortly.
Got it, Chair Jones. Thanks.
Hello, am I audible now? Can anyone hear me?
I can hear you, and I'm on the I'm remote.
Okay.
Two people are clapping inside the conference room, but they may be muted.
Yeah. Okay, thank you.
Okay, let's go ahead and proceed. Yeah.
Good afternoon, members. My name is Ivan Dagla, Director of Communications and Communication at Central Health. And before I share with you some of the details that are pertinent to the groundbreaking celebrations at Bell Valley and Hornsby event, I want to acknowledge the tremendous amount of work that went into both of these events that were led by our colleague Yesenia Ramos. And then I also want to acknowledge and give a major shout out to our communications, community engagement. I also want to give a major shout out to our communications, community engagement, and outreach teams across the enterprise, including Sendero's outreach team and Elizabeth Marrero and her team that stepped in to support our team here at Central Health through all of these efforts. The events included student performances, they included free barbecue and refreshments, children's activities, and a resource fair. Both events featured a feedback gathering activity to help continue shaping the centers, particularly around the areas of amenities and wellness programming. Hornsby Bend has stood out as an area of need around food assistance. So our partner Community Coalition for Health brought their mobile food pantry to the Hornsby Bend groundbreaking celebration. And some of our participants and attendees included families across the Valley ISD, community advisory members, parent support specialists, elected officials, and a variety of health and wellness organizations, such as Community Coalition for Health, Central Texas Food Bank, and many, many others who participated in the resource fair. In terms of promotion, partnering with the Valley ISD performing arts teachers was critical in driving attendance to these events, as the families of students performing showed up to support their children. We also garnered the support of parent community liaisons who sent students home with stickers and flyers promoting the events and sending texts to their parents leading up to these events. Of course, we also relied on promoting the events on Facebook, Twitter, Instagram, and via email invitations. Next slide, please. For the Hornsby Bend Health and Wellness Groundbreaking Celebration, 324 people attended. 16 organizations participated in the resource fair. 100 grocery boxes were distributed by Community Coalition for Health.
No. Have three.
Well,
as chairman candidate.
I'm strategic.
How many do we need?
She's coming back.
Vincent, you're ad hoc, so I'm sorry.
Yeah, okay. Thanks very much. Appreciate it.
For the Hornsby Bend Health and Wellness Center groundbreaking celebration, 324 people attended. 16 organizations participated in the resource fair. 100 grocery boxes were distributed by Community Coalition for Health. 54 families provided feedback on the center's amenities and wellness programming via the surveys. And it's not on the screen, but also it's worth noting that 30 people signed up to stay informed and involved. And then for the Del Valley Health and Wellness Center groundbreaking celebration, 207 people attended. 17 organizations participated in the resource fair. 54 families completed the surveys, and 35 people signed up to stay informed and engaged. These events were very much worthy of media attention, so I'll turn it over to my colleague, Mike McKinnon, who will share some information around that next. Mike?
Sorry, I'm a little lost. Sorry, I was looking for my notes and I realized that they're all right in front of me. So I do want to start off by giving a big kudos to a couple of our team members. Edwin Evans, who is basically our staff shooter, photographer, videographer, and then our new public relations specialist, Philip Ramadi. They are both really responsible for helping us get this event in the news, and I would say to a greater degree than we would even normally get for an actual grand opening. We have really fantastic coverage for this, including television news and print news. But we did sort of, the usual. We issued a couple of press releases in English and Spanish, but we did something new this time. We held media briefings with the Austin American-Statesman, which actually crossed a couple of topics, but then also with some television news as well. From that, we do monitor media now, and we had 18 mentions, and again, that's for both events, in local media over the period. And we reached 20.5 million people, and that's based on the subscribers and viewership numbers through Nielsen, again, through our media monitoring service. And that equivalent in advertising spending would have been over $500,000. So to say that we got a lot of really positive coverage about this and a lot of community awareness would be an understatement. It was a great success. And then you can see here the media outlets who covered us. And again, just worth noting that the television news actually used our footage that our staff shot, that Edwin shot. We were able to shoot at the event, prepare it on site, and send it to the media, and they were able to cut it into their stories, which was hugely beneficial, as they were not able to send a camera crew out to shoot the event. So again, just massively successful, and to everyone who helped, and not just Philip and Edwin, but the entire team who were pitching in and coordinating interviews and rounding up folks to talk with the media. Just utmost thanks. So,
Next slide.
next slide.
So we will launch our communications and community engagement plan for the actual clinic opening 6 months in advance of the openings. Right now, as you know, we're planning to open the clinics in summer of 2023, right, Stephanie? Through our COVID outreach the last 2 years, and with the help of our consultants, we built numerous and extensive community partnerships that we're going to continue to leverage and cultivate throughout our run up into the clinic openings. The relationships are primarily with neighborhood and community groups, local businesses, community organizers. And as a reminder, we've reported this before, we actually reached out and partnered with more than 1,300 businesses, apartment complexes, faith-based organizations. And again, I want to give a shout out to our outreach consultants, literally our boots on the ground, where we delivered information kits, PPE, fact sheets, posters, and these businesses and organizations have committed to partner with us in the future on activities like this. We focus during COVID and always on communities and demographics that are hardest to reach. And so we employ tactics that help us reach those communities. It's everything from picking up the phone and making phone calls to MAP members to talk about where they can get tested, where they could get vaccinated. And we will continue that. We'll talk about that just in just a minute, but also all the way up to the broad level air cover of paid advertising. We do want to inform the wider community of the clinic openings, but our main goal is to reach potential patients, to let them know about the services that will be available to them and make sure they're prepared to use their services once the clinic opens. We'll do that in a variety of ways. So again, outreach to our MAP members during MAP member enrollment, making sure they're aware of the clinics, recruiting partners who might want to use that space and offer services in that space. And it's very similar to the work that Elizabeth has been leading for the Northeast Resource Center. And so Elizabeth will talk more about what's already happening, and the team will talk about what's going to happen beginning essentially in January.
Hi, I'm Elizabeth Marrero. I'm the Senior Director for Community Health and Wellness Initiatives. So my team is at the community resource areas and sites, several of the clinics in person, and we're interacting with the patients in the community on a daily basis. So we've already started the groundwork to develop robust sites that the communities and neighborhoods will use. We're trying to gain buy-in, already meeting with community members, sitting in on community neighborhood meetings, and also meeting with other community partnerships to discuss their interests in providing services or access points through our locations that we're expanding to. We've already put some signage out, letting people know that we're going to be there. We were at the groundbreakings, letting them know, giving them a taste of the kind of services that will be coming to those locations, giving them a point where they can ask questions. We are going to use a similar plan to what we did with the Northeast Health Resource Center, which has been doing tremendously well since we opened in March of last year. We already have been very involved with that community. When people come in, we're providing resource referrals to many different partnerships. We've already gotten several interests on being partners at these sites. WIC is very interested, Foundation Communities, Travis County has a food pantry in Del Valle. So these are just some of the examples of partnerships of people that I'm meeting with. We're just having conversations now. And so we want to, so that we're ready when 6 months out, we're ready to open, to know, what we can tell people. We want to make sure that they know what's going to be there, how they could, what hours we're going to have, all that kind of stuff. So we've already started doing several work there, and we'll just continue to do that and support the communications team in their work as well.
Great partnership that we had. I just thought about the open house that we did for Northeast Health Resource Center not too long ago, which was super successful, and it was beyond the opening, so that helped a lot. So 6 months out, so starting on the timeline, 6 months out, January 2023, we'll build off the successful groundbreaking events that we were just talking about, which set a new bar for outreach and engagement efforts at Central Health with more than 650 participants and attendees. We've already primed the pump, and now we can build the excitement with residents, partners, and the media. Our community engagement efforts will be geo-targeted by zip code surrounding the clinic, so 78617, 78725, and the surrounding zip codes. So 6 months out, we will begin a series of direct mail pieces to low-income households and promote the grand openings in our weekly emails. Also, working with our advisory committees, community advocacy groups, and our partners, we will consistently push out information about the health and wellness centers. So some of those partners include Del Valle ISD, Del Valle Community Coalition, Austin's Colony Neighborhood Associations. So there's multiple of them. Also, community residents that are very active in their communities from Kennedy Ridge, Forest Bluff, Greenmore, and Mustang Ridge, and many of the surrounding communities as well. We also have a relationship with the Austin Latino Coalition, HORNSBY Assembly of God, Santa Barbara Catholic Church, and many, many others that are so many to list. As we did for the groundbreaking ceremonies and our Voice of the Community work for the Healthcare Equity Plan, we will also leverage our relationships with schools in the area. So we've been talking with parent support specialists at Creedmoor Elementary School, Pupham Elementary, Dunlap Elementary, Gilbert Elementary, Daly Middle School, just to name a few. And then our grassroots outreach efforts will build off our COVID outreach efforts that Ted was just mentioning a little bit ago, in which our outreach consultants and staff visited more than 1,300 local businesses, apartment complexes, and faith-based organizations. So we'll deliver coming soon flyers and posters and activate these partners to make sure that that we generate some buzz leading up to these grand openings. And next, Mike.
Yep. And so 3 months out, that's essentially when advertising and marketing begins, and that's essentially when we start spending some money. And so we're going to be going with geo-targeted online ads, meaning, as Yvonne said, it will people who live in the affected zip codes will be primarily targeted with these ads. So paid social media through Facebook and Instagram are always very successful for us. We're also looking at the possibility of doing some newspaper ads. Of course, the community newspapers, we have a good relationship with the Villager, doing advertisements in English and in Spanish just to make people aware of what's going to be happening. And we'd also be exploring some opportunities for outdoor advertising, so billboards or gasoline pump toppers, that sort of thing. Just being aware that that area of Travis County, there's not a whole lot of real estate with regard to billboards. So we will have to get creative, but we've gotten creative before.
Tesla may change that.
Tesla may very well change that, but we do have a great advertising partner who understands us very well and can help us with the media buy in those situations. And then we'll also start to schedule more press briefings. So I mentioned those previously when we were talking about the groundbreakings, where we'll just coordinate with the local media and bring in staff to discuss what's going to be happening, when are the clinics opening, what do they mean? And we just want to make sure that the media, as much as anything, is just up to speed on what we're doing and aware of the timeline and the services. And then we'll be creating press kits as well, which we also did for Northeast. Make those available on our website and just distribute to the local media. And Yvonne will.
Yes, so also 3 months out, our grassroots outreach efforts will continue with the distribution and placement of yard signs, street signs, those realtor campaign signs, and MAP member outreach as well. So calls and texts to our MAP members. Also, community care will do a mail drop, so direct mail campaign, and a text campaign to those who are established patients. And it's also planning to table at events and offer financial screenings. 1 month out?
1 month out, that's really the final push. And so everything that I spoke of previously will be intensifying. We'll be doing more social media, digital advertising and promotion. Another thing that has worked well for us in the past is radio. One nice thing about radio is we're often able to leverage radio buys to include added value opportunities. So things like remotes, or they'll just give us more airtime, or we'll be able to go on live and actually discuss with the host. So that gives us more opportunities to reach a wider audience in that final month. And again, all of these these advertising pushes are going to be co-managed with our advertising partner, Belmont Ice House. And then we'll just continue that media pitch. We're going to be pushing these stories to the local media. Hopefully those press briefings that we had conducted previously will pay off at this time. But as we did previously, we'll be supplying video, we'll be supplying interviews, we'll be supplying fact sheets, and just trying to generate as much media coverage as we can, actually leading up to the event, the grand opening event.
Leading up to the opening of each health and wellness center grand opening, we envision a grand opening week, not a grand opening event. So we want to give residents multiple opportunities to come by and tour their health and wellness centers, and invite community groups to share in the celebration as well. We'll have a grand opening event at the end of that week, and press conference to officially open the facility to the public and begin seeing patients. As mentioned earlier, during the groundbreaking celebration, a total of 65 people signed up to receive updates during the groundbreaking celebration. So we will continue to grow those lists so that by the time the grand opening weeks come around, then we'll be sending texts and updates to those people who subscribe to stay informed. The grand opening will also feature student performances, a resource fair, door prizes, children's activities, food, tours of the facility, a press conference, and more.
Great. Next slide, please. So finally, how can you help? First of all, thank you if you were able to attend the groundbreaking ceremonies. You're our best ambassadors. And so we want to make sure that we give you the information and tools that you need to help us promote the grand opening. And so here are some of the ways we want to arm you with information and tools. We're developing a campaign toolkit that will include flyers, posters, and a PowerPoint presentation. So you will have those in hand that you can either deliver, pass out, or email out. We would love for you to have that PowerPoint presentation in case you have opportunities to present to your organizations and your networks. So you would be essentially joining our speakers bureau. You're better ambassadors than we are when it comes to talking about our clinic openings, and so we want to take advantage of that. We would like your help identifying groups or organizations or individuals that perhaps we haven't thought of or we haven't talked to that would be interested in either a virtual or in-person meeting, so we can provide them with updates, encourage them to join our email list, and of course, we want them to join in the grand opening celebrations. And then finally, just sharing on social media. So if you're active on social media, I know some of you are very active on social media, we want to give you content that is shareable that you can help spread with your networks again. With that, thank you for your time, and we're happy to entertain questions.
Thanks very much. That was a very good presentation and excellent work in terms of the actual groundbreaking. I had the opportunity to participate along with my colleagues, and it was very good. So I want to commend you, your staff, and the outreach work you're doing in the community. Thanks so very much. We'll open it up. I have some questions, but I'm going to save mine for Ian. So I'll open it for questions. Manager Valadez.
Thank you. One of the things that was extremely clear to me is that the groundbreaking events were not.
Can you put on your speaker, Manager Valadez?
I'm sorry. We're not accessible for the physically handicapped, those that had mobility issues. And I spoke to, at both locations, to the people that were receiving input. I also saw that in the plans that were presented, there did not appear to be one item that would have affected or impacted the quality of life of someone who has a child or a family member who lives in those neighborhoods, who also is physically or intellectually or visually impaired. So my suggestion to Mike was, we need to incorporate that somehow, because they are a huge member of our population, a percentage of our population. And if you look at the special education populations within those school districts and those campuses, it could be up to 25%. So we're talking about a significant impact on a person's quality of life. So please include that. In addition, it would be great if there was a donation, or that's what I asked for. He said that there was, I don't think in the plans, they may have included equipment for, especially those that are having a playground, for people who have special needs. And so we need to make sure that we get that incorporated into the design plans. And we also need to make sure that we are actively and aggressively searching for partners who might be able to help us with that. ADAPT Texas, I'm a part of ADAPT. I'm also a part of the Partner Care for families who need resources and supports. And those kinds of resources would also be great to include in packets, information packets for those communities. And also Travis County is going to be opening some affordable housing apartment buildings in those areas. So it would be good to maybe coordinate with them to see what their expectation of openings are and be working to coordinate, because I know that they're already taking applications, or at least are seeking community support for that. And there's an overwhelming amount. And as those areas are outside the incorporated area of Austin, there's no bus transportation, there's no grocery stores. We all know those stories because we've been bringing them to Central Health since time immemorial, since Central Health was created. Because we want to make sure that those populations know that there is something coming their way, or there's something that we have partners that are going to be providing those resources to them in those areas. And so aside from that, I love the fact that we had so many kids there. That's what I like to see. I like to see families there, and because that's what we are reaching out to. We're reaching out to families, and we can't handle the health of just one individual. We have to look at the entire family, because that's our family. And so I just want to tell y'all, thank you for doing a great job. And let's make sure that we try not to forget that there are other entities. And even if we don't see it, maybe they are included, but even if we don't see those things being made available to them, it speaks to those populations that appear that they may be excluded. Thank you.
Thanks very much, Mr. Bella. Did you want to quickly respond?
Yes, I just wanted to respond, and that was one of the things that we had at the groundbreakings was a feedback session. So that was very good feedback that we received to identify that we needed to have more accessible playground features, because that was one of the requests that was made by the community, to have a playground feature, but to incorporate more accessible pieces. We are definitely, because of that conversation, we're definitely looking into that now. We're working with construction crew to see how we can make that happen, how best to make sure that we're mindful of that the site will be accessible to everyone. So thank you for the feedback there, and we are actively looking into it. And those are the kind of things that is really helpful for me in my work with ADAPT and reaching out to them. I am meeting with Cap Metro and seeing where we can identify some of those gaps of what we can do until the public transportation reaches out there for those patients and community members to access the site.
There's a lot of equipment that's available, like water tables, texture for those that may not be able to see, texture things,
sensory things,
sensory motivation.
Yeah, I went down a rabbit. I started looking at everything. Oh my God.
I have books, so
Okay,
please,
okay.
Thank you.
Appreciate that dialogue, Manager Asante.
Thank you for that presentation. Thank you for a wonderful event. It was really heartwarming, and I really enjoyed it. And I was one of the speakers who was invited to speak, and the feedback that was received from the community was amazing. And I look forward to more clinics like that and events that we can engage the community, because eventually this is for them and not for us, and we're there to serve the community. One comment that I have in relation to the week-long celebration, don't you think, I like the idea, but it wouldn't add a added burden on the staff, and will they also be receiving the same services and the partners who are in attendance? So I'm just fearing that the scale will be at a much smaller scale, where that grand opening was a great celebration.
So we look at it as an opportunity during the week. Perhaps one night there's a night where the different social services that'll be offered there have their own evening. So not big events every night and all day every day, even though this team would probably try to do that if we didn't stop them. But we will build up to a big Saturday event that will be like the groundbreaking. But we just want to give folks during the week, if they want to stop by over the noon hour or after work in the evening, just make sure they have access to the facility. And we'll plan a schedule that will last a week, just trying to build momentum to the actual cut the ribbon, open the doors, and the clinic is open.
Maybe every day having a theme.
Yeah,
That
love
will
it.
attract people.
You're on
Thank
the marketing team. You're hired.
Thank you.
Okay, in the interest of time, I just asked one. Were there any other managers have questions? I just had a couple of comments. One, when you mentioned the targeted zip codes are very large for those areas. So can you just quickly talk about some of the communities that you're focusing in on? Because I didn't hear Weberville particularly. And even though it's right on the county line, I want to make sure that Weberville is part of the outreach effort.
Weberville is part of that. Yes, Weberville is part of the list. But yeah, Mustang Ridge, Weberville, Forest Bluff, the Austin's Colony area in Hornsby Bend. So the larger, we call it the greater Hornsby Bend area. Okay. And then of course Del Valle is very vast, but we focus in on the different communities around Creedmoor, and there's more Mustang Ridge in there as well.
Okay, thanks very much. I appreciate that. One other question is that I didn't hear, I heard you mention some of the ethnic groups in terms you're working with in terms of outreach. Are you going to also incorporate some of the African American community, maybe the Asian American community, targeted community in terms of that? Because I heard you mention the Latino Healthcare Forum, but I know put something like the NAACP, maybe the Asian Pacific Islands.
Austin Urban League as well. We're in conversations with the Austin Urban League as well. So absolutely, they're part of our outreach targeted efforts. And then we also have Community Coalition for Health, who is helping us through faith-based outreach as well. So we understand that faith-based outreach has to be part of our strategy to reach our African American.
And these organizations are also part of the Voice of the Community initiative for the healthcare equity plan. So now they're part of our database. So we'll reach back out to them and ask them to help us amplify the messages.
Okay. All right, then I think that's all I had. No other questions or any item on this item. We'll go to our next item, which is, there's no motion necessary on this. So we say confirm the next Eastern Crescent Subcommittee meeting date and time. Managers, our next Central Health Eastern Crescent Subcommittee meeting is tentatively scheduled for August at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. We don't have a particular date in August, but I do anticipate it'll be notified in adequate enough time. Is that right? Is that right, Pearl? We'll have a date identified. Okay, then. Okay. At this time, I'm ready to accept a motion for adjournment. Have a motion to adjourn. Is there a second? All in favor, say aye. Aye. Any opposition? We'll consider ourselves adjourned. Thanks so very much.
Thank you. And in the interest of time, I'd like to move right on into the Strategic Planning Committee meeting. I'd like to say that to start, this is a very important meeting for us. And so please, pay attention, save your questions until the end. So good afternoon. Today is May 11th, 2022, and it is 1:40. Oh. Okay, thank you. So good afternoon. Today is May 11th, 2022, and it is approximately 1:40 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feed of all participants closely to make sure we have a legally compliant meeting at all times. So now we will proceed to the committee agenda. Number 1, review and approve the minutes of the February 2nd, February 9th, and February 15th, 2022 meetings of the Strategic Planning Committee. No, that's fine. That's fine.
1 second.
Great, thank you. Number 2, receive and discuss an update on the fiscal year 2022.
Chair,
vote, I'm sorry, everybody agree?
And
on-
also, I think within the motion, February 2nd and 9th and 15th, so she did not state those. So do you want me to read, or do you have the motion in front of me to read it?
I asked if I needed to. And they said, here for the adoption of the minutes for the February 2nd as.
Second,
Oh,
2nd, 9th, and 15th.
2nd, 9th, and 15th. Of the.
thank you. And do I have a second?
Second.
Thank you. And a vote?
Aye.
Great, thank you. So now we'd like to receive and discuss an update on the fiscal year 2022 budget resolution strategic priorities and proposed fiscal year 2023 budget resolution strategic priorities. Monica Crowley, Stephanie McDonald, Jonathan Morgan, Cynthia Gallegos, and Doctors Alan Shosha and Audrey Kwong will be presenting.
Thank you, Chair Brunson. Monica Crowley, Central Health. Every year for the past, I think, 3 years now, the kind of preview to the very beginning, it's the preview to the beginning of budget season. So the beginning of the beginning is a mid-year update on the current year's budget resolution priorities and a high-level introduction of the proposed budget priorities for the coming fiscal year. Today, we are here to present to you on our fiscal year 2022 year-to-date activities and the proposed fiscal year 2023 priorities. As you may remember from past years, over the coming months, we will be coming back to you with deeper dive presentations in strategic planning and in the board meeting on all of the proposed priorities. And there are going to be additional ample opportunities for you to continue to provide feedback. And as you may remember, that the priorities that are proposed never end up being exactly the priorities that are adopted. So we appreciate the feedback and the opportunities to have kind of more fulsome discussions. And we also have Anissa Kendall with us today, who is instrumental in the service delivery strategic plan or healthcare equity planning work, in case you guys have any questions that come up. So thank you. Next slide, please. So we always want to remind you, I'm not going to spend any time on this, but we are still under our fiscal year 2019 through fiscal year 2024 strategic plan. And all of this work is in service to the identified objectives of the strategic plan, including the healthcare equity plan. Next slide, please. And I'm now going to hand it off to Stephanie McDonald.
I think you're well aware that this priority is underway. We are really excited. We did mobilize our general contractors on the Del Valle and Hornsby Bend sites. I do want to caution everybody that we are still in a kind of round of site development plan review with the city of Austin, and they are 16 reviewers down. This is an iterative process, so unfortunately, sometimes a comment is made, we address the comment, then a new comment is generated. I checked in this morning. I actually checked in with I'm working some relationships inside the city. They have given me some insight. We are trying to make sure that this is the final round if possible. There's a lot of work, thanks to our colleagues at the Travis County Attorney's Office. We were able to do a traffic mitigation agreement where we contributed a fee in lieu of to the Travis County for the Del Valle site. We've got some easements underway with Southwest Water Corporation and getting the water utilities for Hornsby Bend. So we're really very excited. We are very optimistic, but regardless, we are currently on time and on schedule. Next slide. There's the pictures of the outside renderings, and happy to share any other pretty pictures you might want. Next slide, please. I think I'm gonna pass it over.
Actually, and this is just going back to the sustainable financial model priorities. You have received and will continue to receive closed session updates on the hospital care and services model work. And related to the Brackenridge campus, I think, Stephanie, you can provide an update on the debris removal and grading, but on the redevelopment approach and options, that work has also been impacted by considerations that have come up during the other negotiations. And, you know, we can also continue to update you in a closed session on those. But
And we are on the final home stretch of the grading and the debris and the demolition. July is our targeted date. We've gotten everything green lighted in the city of Austin. We're really excited to kind of be done with the demolition work there.
next slide, please. And I think now Cynthia Gallegos and John Morgan are going to take this slide, and Cynthia is here and John is on camera.
New managers, sorry I couldn't be there in person this afternoon. Cynthia and I will be taking this slide together. As you all are aware, in pursuit of the strategic priority for the patient-focused and coordinated healthcare system, this year our staff conducted a planning process with financial support from the Episcopal Health Foundation that included a first of its kind community health needs assessment that really focuses on Travis County safety net and Central Health's targeted population, as well as a robust voice of the community component that ensured patient, provider, and public input into our planning processes. As you all are also aware, the Board of Managers adopted the equity-focused strategic delivery, service delivery strategic plan earlier this year in February. And right now our staff are actively engaged in a procurement process to select the subsequent firm that will continue into the next phase of this planning effort. And that phase will result in the development of a multi-year operational plan and financial plan that supports the strategic imperatives of the service delivery plan. And of course, we'll continue building on the progress from recent years. Cynthia is going to take over the last part of this slide. Cynthia is our Director of Service Delivery Operations. She's going to provide just a few highlights on our current year clinical focus areas and our related initiatives, most of which are implemented under her leadership. Cynthia?
Thank you, John. Thank you for having me here. It is a pleasure to be able to speak on behalf of the many, many pieces of work that we've got going on this year. So I'm going to kick us off with speaking a little to the specialty care access expansion work that we've got. We've been putting a lot of effort in continuing to expand in the endo, podiatry, nephrology space, one of the more recent ones being in the cardiology space. And really our teams continue to work a lot with all of our different FQHC partners and just network providers to ensure that we're helping facilitate as we expand so quickly, so that we can kind of help ensure that the patient experience is one that's well felt. We're continuing to also build new programs from the initiatives that are coming out this year. Two of those examples being medical weight loss, as well as one of our really exciting ones being outpatient dialysis. The outpatient dialysis, as you can imagine, is one of our most exciting pursuits this year, as patients are going to be able to receive outpatient dialysis at which they have never done so. I think historically it's only been from a hospital setting. So really big, really exciting. And we have currently been able to successfully execute 2 of the agreements that we need in order to make that come to life. We have one of our last agreements, the facility agreement, that we're really trying to push forward over the next several weeks with the idea that we might be able to get this program off the ground sometime in June. So big kudos out to the team. A lot of work and sweat have gone into that, as it's such a complex piece of work. Probably one of the largest that we've taken here within my time here. Speaking into, I guess, moving on to healthcare for the homeless, that's another area that we've had a lot of really great success. Medical respite was one of the large movements that we had earlier this year. We were able to turn on the program in early March, and we were actually able to get the first patient in to receive services. I think it was by March 10th. it was a huge success, and Dr. Kwong is going to be able to dive into that a little bit further to be able to provide some of the stories behind that. Residential rooming is another area in which we were able to do some expansion efforts, and that was with one of our existing partners, Fresh Start. We were able to go ahead and expand to include MAT basic patients, which was another really big exciting win for us. And then on a similar note related to street medicine expansion, this is another effort that we continue to pursue with our community care partners. This initiative really aims to expand our psychiatry access, as well as dedicated mobile units. And we're really excited to say that CUC has put a lot of effort into this and has been able to start the procurement process behind purchasing another vehicle. So that work is moving forward. And once again, we'll make sure to be able to provide additional updates related to that as it continues to push. Moving on to substance use disorder, that's another really great area in which we continue to partner with community care. They were able to fully internalize and grow an MAT program where they're able to provide primary care medication assisted treatment program in which they're able to also expand the psychiatry access. In parallel, outside of community care, we've been collaborating with our integral care partners in which they've been able to launch their MAT at Stonegate, or I misspoke there, not launch, but they're actually working to get that program off the ground. It's my understanding that they're continuing to finalize the recruitment efforts there for a psychiatrist to help lead that program. So we continue to work with them to help ensure that that gets operationalized, and we're kind of excited to see that roll out in the next couple of months. Let's see, clinical and patient education is another area that we'd like to share with you. I think you may have heard that we did go ahead and onboard a dietitian and a CHW individual to help kind of get that pilot off the ground. We do have that individual working with our nephrologist in particular to help screen and identify patients with chronic kidney disease. They're also working at the Mexican consulate and helping navigate patients through our system, which is really exciting work for the population that we serve. Outside of that, some of the next areas that we're hoping to have that model kind of expanded to is going to be around the heart failure program. So we're looking forward to being able to kind of take that, bring that back, and kind of tell you how we're able to grow that model. So a little bit about our clinical and patient education work. And then I'll go ahead and kind of end my comments around the transitions of care work that our teams are working on. But we've really been able to work with some of our key stakeholder partners in this area, really developing protocols and processes to help reduce wait times from the time that the patient discharges from the hospital to the time that they get in to see their PCP. And another goal that we have as part of that program is really to help reduce readmissions for heart failure patients. Other areas that we're continuing to pursue in this area of transitions of care include infectious disease treatment, and as well as previously mentioned the outpatient dialysis work and the medical respite work. With that, I think I have the privilege of transitioning us and introducing us to Dr. Kwong, who is the Director of High-Risk Populations, who's going to speak a little bit about our medical respite work. Okay, next slide.
All right. Well, yes, medical respite opened March 2022. And for those of you who know me, you know that I've been fighting for this for over 5 years since I came to Austin. So I personally want to thank Central Health for courageously answering the call of this great need in our community. And so it was a huge blessing to our community once we opened this. For those of you who are not as familiar with medical respite, it is essentially a space to give individuals experiencing homelessness more time to recover, work on their health and social needs in a safe environment, who would otherwise be trying to heal from their medical conditions on the street, which we know is very, very hard. Medical respite right now is located at a new entry, which is a residential treatment program on Weberville Road, which is off of MLK between Springdale and I-183. So I'll start off with a story. This is Mr. P. He's 63 years old. He's been homeless for over 20 years, and on December 13th of 2021 was hit by a truck. and sustained very serious injuries, broken neck, back, shoulder fractures, rib fractures. He dislocated his hip. He was in the ICU for over 2 weeks, in the hospital for 40 days. To top it off, he had a blood clot in his lungs. And that is a very, very tricky thing when you're on blood thinners and trying to undergo 2 major surgeries. After 40 days in the hospital, he was discharged to a nursing home. He was still using a wheelchair and required further physical therapy. He was in the nursing home for 6 more weeks. And at that point, for many patients, they would be, almost healed, but not completely healed. And many patients without respite would be discharged to the streets to continue trying to heal, which we know is very impossible. So on March 10th, he was discharged to a new entry. He was our first medical respite patient. And there he continued to get physical therapy. He was able to apply for disability, which he later got, and applied for social benefits. And then on May 4th, just last Wednesday, he moved into a tiny home at Community First Village. So a beautiful story for our very first medical respite patient. And so with this story, I just wanted to leave you with four thoughts. On the day that he was supposed to go to medical respite, he had a primary care appointment at Care Connections Clinic. I happened to be there, and the doctor there ran into me and thanked me profusely for allowing him to go to medical respite. And it dawned on me that for so long I've been fighting for this in our community at a high level. But for so many people who are on the front lines, this is very personal. And I could see in his eyes that he felt finally some relief that this patient wouldn't have to go to the street, but would then continue to be in a safe place where he could work on his healing. And to see that look in that clinician of that relief really dawned on me how personally important it is to so many of us in this community to know that this person would have a safe place to continue his healing. He had been in the hospital and a nursing home for over 2.5 months. And the thought of discharging him to the street was just horrifying to this doctor. So this is a great need, and we're so thankful for this in our community. The second thing that I realized is that this medical respite has been born out of hospitals who want safe discharges for their patients. And so many programs across the country are financed and supported by hospitals, which is important. But what I think is really unique and special is that Central Health is in a unique space that they have a higher perspective. So while a hospital program who's funding respite will really want to take patients coming to the hospital, we have a more systems approach that we don't want to wait till they get to the hospital. We want to help patients before they get to the hospital if we see them on street med, or if they're coming out of a nursing home, that we don't want to have them discharged to the street. So I think Central Health's role is so unique and special that I didn't realize that we have the capacity to really help patients at multiple access points. And so this brings me to the point that we want to start small. We're learning a lot. And we have started with 5 beds at a new entry. And our first phase is to take patients from skilled nursing facilities. And I think that's really special because that doesn't exist before. And so we want to continue the healing of these patients, and Central Health's role in this has been really unique and special to be able to take patients from nursing homes. And the next phase would be from our street medicine team, from our healthcare, from the homeless colleagues, and then from the hospitals. So really a systems approach to meeting people where they are at and not waiting till they get super sick. The third thing I want to leave you with is that medical respite at its most basic level is space to heal. It is a room, it is a bed, and that is really great for medical healing. But this case really gives us a sense of something greater, which is not only did this gentleman heal medically, but he had a space to finally work on other things so that the eligibility specialist from Central Health could help him apply for Medicaid and Social Security, that our social worker was able to help him get a interview with Community First Village, get him on the waiting list, and to get him into housing. And our health management liaison was able to help him with his medications, his blood thinners, getting him into his follow-up appointments. So we were able to leverage the Central Health medical management team with our with our respite program, which again is so special. A lot of hospitals are working, to find a hotel room, a bed, a place for an individual to stay. But the central health case management team was able to come alongside him and offer so many more things. And by providing a space for him, we were able to keep that momentum going of his healing, not only medically, but to provide him with social benefits and a safe place to continue, and then discharge him into housing. And then the last thing I want to leave you with is this is a beautiful story. And I wish everything was so linear from hospital. I mean, I think about this gentleman who's been homeless for 20 years. And now after a car accident in 4 months, he's in his own tiny home. And that is so beautiful. And I wish everything was so simple and easy and linear. And while that is a success, we were able to get him into housing and prevent a rehospitalization, because I am pretty sure that if he was discharged to the street after his hospitalization or after a nursing home, he would probably end up back in the hospital. So those are the things we absolutely want to track. But the other thing I would say is success can be measured in other things. It is the restoration of dignity. It is an opportunity to work on all these social things that he had a chance to do. He was able to work on some addictions that he's been struggling with. And so it may not always be this linear. And so in the 10 individuals that we have admitted since we've opened, you can see some of that data, that some of them have multiple conditions, end-stage renal disease, fractures. Some got into housing, some decided to leave, but the time that they were with us, they got to know our team, they made the connections to a primary care home. And so whatever happens, we were able to make that connection, which I think is just as important. So it is an early start to our road of respite, super exciting. And I'm just so grateful to Central Health for helping give Austin this chance for our patients who are experiencing homelessness a chance to heal and change this trajectory of their life. So thank you.
Thank you so much, Dr. Kwong. Thank you for sharing both your work and that story. Next slide, please. So this is just a visualization of something that John went over in his slide. I'm not going to belabor it, but it's just you guys worked on the what during the beginning part of this year, and that was our healthcare equity plan. We're now almost done with the RFP process for the how and when, which includes the operational implementation plan and financial sustainability plan. Next slide, please. And it just, we're teeing this up before I'm about to hand it off to Dr. Shalsha, who will go over the proposed fiscal year 2023 budget priorities, which is, different, and it's meaningful that our new chief medical officer is going to be presenting on these priorities, because the healthcare equity plan is nested within the strategic plan. And it was built in service of the current strategic objectives, and it's serving as a guide for our work going forward. And so we have organized the proposed fiscal year 2023 strategic budget priorities, strategic and operational budget priorities around achieving the imperatives and the goal of the healthcare equity plan in access and capacity, care coordination, member enrollment and engagement, and system of care infrastructure. And Dr. Shalsha, in the next slide, please, will go over the details.
Thanks, Monica. Good afternoon, Board of Managers. I first wanted to just thank Audrey. Audrey has been an energetic advocate for respite and a steward for actually making that happen. Also, our medical management team, which has been working, on that initiative. I also wanted to thank the Central Health Board. This is really our first foray into, transitioning to the direct practice of medicine, and the good patient care and the potential is just building. And so, the work we deal with on a daily basis deals with people and people's lives. And you can see the passion that Audrey has and the clinical acumen, and there's just more to come. So her leadership and those that sit on the medical executive board really will, lead us in a good direction. And we really want to thank you all for that support. Which leads me to next year's strategic priorities. Looking at access and capacity, in addition to the locations, the additional clinic locations that will be coming on board, we're going to look at technology. We're going to look at expanded hours and same day care in order to ensure that we increase our capacity and provide access to those who really need care. As related to care coordination, EPIC is the backbone on which our healthcare is really built. The advantage to utilizing EPIC is that we're starting to build a vertical healthcare system, and more specific, there are partner organizations that are on EPIC, and as our patients transition from one clinical environment to the next, so their records will as well, and we're much more likely to ensure that that patient care will be continuous and that patients will not fall out of care. As we utilize EPIC, so we need to build our policies and procedures, our governance, actually need to roll out our technology and conduct our training. So that initiative is a huge initiative. As related to member enrollment and engagement, MyChart, which is an aspect of EPIC, will allow patients to gain access to care at a location of their choice, whether it's at work or whether it's at home. It'll empower them with their ability to actually manage their own care and interact with their care teams. So really critical for patients to be successful in their health and well-being. Related to system of care infrastructure, you all are very aware that we've conducted a community health needs assessment, a gap analysis. We've listened to the voice of the community and developed a healthcare equity strategic plan. As we continue to mature, the development of our financial and operation implementation plans will develop, and obviously we will continue to work with the board and share that information. Both in open and closed session, we will continue to share our focus on our partnership affiliations and strategic initiatives as we continue to move our healthcare infrastructure and initiatives forward. Related to our direct practice of care, from a perspective of medical management to where we manage, where we help manage patients' health, within their homes, we will be moving towards the direct practice of medicine to help guide individuals through their healthcare journey, sometimes stepping into their homes, sometimes by way of respite, working with partners in transitions of care, and then specifically concentrating on expanding specialty care by way of direct practice. As related to the last priority, to identify and support clinical on-demand operational and administrative capacities. As per this year's budget resolution, which emphasizes the need to provide significant resources to support the current build that we're doing. In addition, we provided kind of an update in the April board meeting packet, really speaking to the many initiatives that we're working on. There's a critical need for us to be able to support our support. So all of the infrastructure that is needed within Central Health has to have bench strength so that we can adapt to critical needs in a very finite amount of time. And so that work is progressing with Mike leading it and the executive board. And I'll stop there. Thanks so much.
Next slide, please. And this is our last one. It's just going over what you can expect in some of the next steps. I know in May it says budget presentation. It's not really the budget presentation. Later it's the financial forecast presentation. We have a deeper dives in the June strategic planning committee. And then Yvonne and Ted and the communications community engagement team are teeing up the community conversations about the proposed priorities for gathering feedback from the communities. We may ask for an hour before the scheduled Board of Managers meeting in July for a deeper dive conversation depending on how, we're going through the presentations. And then that is when the budget presentation will come to you. And then we'll have another opportunity for deeper dives and questions and answers in August. And then hopefully we'll have a budget resolution, not hopefully, we will have a budget resolution for you by the September meeting when you adopt the budget. So.
Well, thank you so much, Monica. I have to tell you, I am just both thrilled and very proud of all of y'all for how much work you've been able to do in really some very difficult times, through the COVID, through this isolation we've all been feeling, and yet you've been able to really accomplish some things that have not been accomplished before. So thank you so much. Yes.
I want to thank you all for the great work that you're doing. When we were putting together the designs for the Southeast
Microphone.
And the only thing that did not get incorporated into the design plan was my request for respite care, because I have a daughter who has required that, and then I had a husband who died because he didn't have access to that. And so a lot of the work that you all are doing is a culmination for what so many in this community need and have not received. So I want to thank you for that. And one more thing, I would like to know whether or not you are working with the governmental agencies. There was a death of a homeless man at Pan Am last week. As of yesterday, the incident was, they're calling it an incident, was not reported. He was found in a porta potty in the park. And so as we care for our homeless population, I'd like to know whether or not you are coordinating with the cities and the counties or any governmental agencies that may have parks within their systems. Is there a time by which they must report a death has occurred on their property? And is there a process in place to determine what the cause of that death is?
Well, thank you.
So I just wanted to bring that up.
Yes, well, and we'll have time to discuss further our hopes and plans. But again, thank you all so very much. And at this point, if it's all right, I would, there is no motion necessary on this. So our next point is that we will receive an operational update from Sendero Health Plans. And Wes Durkalaski will be presenting. Are we doing this in closed session? I apologize. And I announce that the committee is convening in closed session to discuss agenda item 3 under Texas Government Code 551.085, Governing Board of Certain Providers of Healthcare Services. So we are going to close this session, and today is May the 11th, and it is 2:10 p.m.
And we're going to go into closed session now.
Yes, and we're going into closed session now.
Test. Sarita, can you hear us? Or me?
I can hear you.
Can you hear us? Okay.
I can hear you.
They can hear us.
Thank you. So we are back in open session, and again, it's May the 11th, 2022, and it is approximately 3:15 p.m. So we will move on, since that did not require any action to agenda item number 4, which is to confirm the next strategic planning committee meeting date, time, and location. Managers, our next Central Health Strategic Planning Committee meeting is tentatively scheduled for Wednesday, June the 8th, 2022 at 1 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. And at this time, I am ready to accept a motion for adjournment. Okay, we have a motion to adjourn and a second. So thank you. Did everybody want to vote on that? Yes, and so everyone has voted, and so we are ready to adjourn.
Fine, thanks, everyone.